Hello, this video is about fitness safety and avoiding injuries. And the main idea here is it's important to learn how to prevent injuries and respond to them when they occur. Some words we're going to hear are frostbite, hypothermia, overexertion, heat exhaustion, heat strokes, muscle cramps, strains, and sprains. The safety precautions can help you avoid injuries during physical activity. If you're injured or ill while you're exercising or doing some sort of physical activity, you need to seek help right away. One of the main things you hear is before you can participate in the program, get a medical screen, your physical, to make sure that you are healthy enough to participate. That's why we have physicals in 7th grade and your 10th grade year so you can participate in sports. Safety first. You've heard this since you've been younger, but you want to make sure to use the correct equipment, pay attention to people, objects, and the weather. Know your skill level and your limits. Make sure you warm up and cool down. Stay within the designated area for the activity. Obey the rules and restrictions. And last but not least, practice good sportsmanship. The right equipment. First and foremost are your feet. Make sure that they are well protected using athletic shoes that are designed for your sport. Still with your feet, wear socks that cushion your feet and keep them dry to help avoid blisters. And lastly, the clothing. Wear comfortable, non-binding clothing that is appropriate for the weather. If you're going to ride a bicycle, wear your helmet. Make sure your helmet is approved by SNELL or ANSI. You have your reflectors on the bike, and wear light colored clothing with the reflective patches. Skateboarding, you have the helmet, the knee and elbow pads, gloves, and the wrist guards. All right, contact sports, males, there's a cup that you should wear. Non-contact sports, for the males, wear an athletic supporter. Females wearing the sports bras, and if for various reasons, if people with disabilities are taking sport in a variety of activities, to make sure that the equipment and the sport fits for them. Right here they show someone riding a horse with a helmet, just like you would wear while you're riding a bike or skateboarding. The weather. Making sure, watching out for the extreme weathers, especially here in Minnesota. You can be outside on a lake, nice and sunny, and within 20 minutes it can change, into a thunderstorm. But they talk about thunderstorms and blizzards here. All right, watching the weather. You have a hat to escape heat loss through the head, a face mask or a scarf to protect your nose and your mouth. You want to have a base layer, like they say here, that wicks moisture away from your body, and a lot of times you have the underarm that is Under Armour that is for cold weather gear that will wick that away. Insulating layer is next. That is the thicker, the warm, the synthetic fleece fabrics, and then your outer layer that should be waterproof, windproof. It's nice too, and breathable. You also need gloves to keep your hands warm. In cold weather, you still need to warm up and cool down. You still need to make sure you're drinking plenty of fluids because that cold air can lead to dehydration. Cover your nose and mouth to prevent breathing cold, dry air. And talk to your doctor if you have asthma, because there may be some other things that you need to look for. Frostbite. Okay, it's a damage to the skin and tissues caused by extreme cold weather. You want to go into a warm place and thaw the affected area with warm water, not hot water. Hypothermia occurs when someone is exposed to extreme cold, immersion in cold water, or wearing wet clothing in cold or windy weather. And hypothermia is when you get a dangerously low body temperature. Okay, in hot weather, you have to watch out for dehydration. That's very important to drink fluids before, during, and after physical activity. You also need to replace sodium, chlorine, and potassium. That's why drinks such as sports drinks, Gatorade, and Powerade were created to help replace those. When it's warm weather, you have to worry about overexertion, which is overworking the body, which leads to hyperthermia, which is when your body temperature gets too warm. And it also can lead to heat exhaustion, a form of physical stress in the body caused by overheating. Some symptoms of heat exhaustion or hyperthermia is heavy sweating, cold, clammy skin, dizziness and confusion or fainting, a weakened rapid pulse, cramps, that shortness of breath, nausea, or vomiting. All right, if you feel heat exhaustion coming on, go in the shade, rest, douse yourself in cold water, fan your skin, make sure you're drinking fluids. And if you're not feeling better, you need to seek a doctor because you risk a heat stroke, and that is definite medical help is necessary. And that's a dangerous condition because the body has lost its ability to cool itself. All right, it's not sweating anymore, and so then it's not cooling itself down in the body. Actually, the body temperature will rise too high. All right, you have sun and wind, windburn, sunburn, and make sure you're putting sunscreen on to avoid skin cancer and eye damage. If you are injured, you need to make sure you can identify what's wrong and take the correct action for the exercise-related injuries. Some minor injuries are blisters, the muscle cramps, strains, and tendonitis. All right, blisters, usually you'll find them on your feet, and they're formed because of the friction between your shoe and your sock. Making sure your shoes fit well and your socks, and wearing socks are appropriate socks also helps cut down on blisters. You can also put Vaseline on your skin to avoid the friction, or wear one pair of socks inside out and the other side the correct way. Muscle cramps can occur when muscles are tired, overworked, or dehydrated. And that's sometimes a sudden and sometimes painful contraction of the muscles. You'll see a lot of this right now in the football down south, especially in Texas, Arizona, Florida, Georgia, those southern states, because it still is really warm and they're exercising at a high level. So the muscles are tired and possibly they have some dehydration setting in. Why the warm-up is important, because it can help reduce the risk of strains on muscles, and that is like a pulled muscle is a strain. Okay, and that's why warm-up is really important for exercise. You also have heard of a sprain, and you have an ankle sprain. That's where you do damage to your ligaments, and you should see your doctor if you feel a strain. All right, the Price method. So if you are injured, first thing you want to make sure is that the injured area is protected. You need to rest it, put ice on it, put a compress on it, so what they call is a ACE bandage wrap, and then elevate it above the heart. All right, so protect it with a bandage or splint, rest it for at least a day, ice it for 10 to 15 minutes, put a compress on it, and that's, like I said, an ACE bandage wrap, and elevate it above your heart to try to keep that swelling down. Tendonitis is the inflammation of the tendons in a joint, and that can be caused a lot of times from overuse. One of the first treatments they'll tell you is to quit doing what you're doing, so rest it. You also might hear people icing that area, taking some medications such as ibuprofen, doing some physical therapy if needed, and in rare cases, like they said, here's surgery. Some of the major injuries, fractures and broken bones, dislocation when a bone pops out of its normal joint, and a concussion to injury to the brain that can result in severe headache, unconsciousness, or memory loss. That is it for this last lesson here, lesson 4 on fitness, safety, and avoiding injuries.